Folks are, thank you, Shayla, coming in from the waiting room. Welcome, welcome. We're so thrilled that you're here and taking time in your day to be here with us today to talk about veteran oral health in West Virginia. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. And I'm going to go ahead and get started here. Okay, so today I'm going to give us a quick introduction, talk a little bit of who we are about AIDPH, go over some housekeeping pieces. We'll take a look at veteran oral health at the national perspective, and then we'll dive into the data in West Virginia and look at what the state of veteran oral health is in your state. There are going to be a lot of opportunities for interaction and engagement from you. So we invite you to come on camera if you're able, get ready to share your thoughts. We want this to be interactive and a conversation, not just hearing my voice the whole time. So get ready to chat, and we'll go over the ways that we're going to do that in just a minute here. So sharing some housekeeping pieces, we are recording. If you didn't hear that when you came in, we're recording this session. The slides, the recording, and all the materials from this session will be available on our Academy, which is our digital learning space. After this session, we'll send a follow-up email. So if you miss a part or want to reference or want to share this out with colleagues, you will have all of those resources. We have CEUs attached to this session, and that information and requesting your CEUs will be in the Academy as well. We invite you to put your name, your email, your organization in the chat. Again, this is a session that's meant for conversation and stakeholder connection. So we encourage you to introduce yourself in the chat and connect with each other as we share about our work here today. We have Shayla and Annalise from AIDPH here as well. And if you have any questions about Zoom or any pieces there, you can put those in the chat as well as questions on the presentation. So we are going to, like I said, have lots of opportunity for engagement. And we're going to use Slido to do our engagement today. So you can go to slido.com and plug this code in, or you can take your phone and scan the QR code. And as you do that, I'm actually going to toggle over. We're going to do a quick tech check, and I'm going to see, can you see Slido with the QR code now versus on my slides? Okay, perfect. So I'll give folks a second to pull that up. We can also post this code in the chat. Okay. These are our learning objectives here today. These are tied to our CEUs and encompass what we're learning here today. They're also available in your registration. And we are going to go to Slido. So if you pull that up on your phone, toggle back over to that, and we're going to do a quick poll about what brought you to today's session. So we'd love to hear from you, and we want to know, did you come here to learn, to share, to connect, act, or maybe all four of those? And let's see. Okay. If y'all can see the poll here, Shayla, if you can give me a thumbs up if we can see the poll on the screen. Perfect, thank you. I see that 67% say all of the above, which is fantastic. 33% say learn. Let's take a look and see. All of the above, 50-50, learning and all of the above, which I love. That's fantastic. Okay, that was a little warm up, gives us a little bit of a level setting of what we're hoping to accomplish here today, and also gives you guys a chance to check Slido. Don't close it out. We're going to come back to that and continue to use it. Okay. I am sharing that we do not have any disclosures to share from the presenters here today. I introduced myself. I mentioned that Shayla is with us here as well from AIDPH, along with Annalise, who is our executive director and co-founder. And we just want to say a big thank you to Bobby Steele, who is the director of the Division of Community Oral Health at Marshall University and had a big part in making sure we could pull this together and invite all of you here today. So a big thank you to Bobby. Okay, so back to Slido again, we're going to go to another poll. And we want to know, what do you believe are the top priority areas for veteran oral health in your state? So this will really, again, give us some level setting and help us tailor our presentation here today as we go into the state-specific data. Okay, access to care. We have this poll in every state that we go to, and I think access to care is always the first piece and always at the top there. Okay. And if you're having any problems getting to Slido, you can pop that in the chat. We'll make sure the code is there. You can let us know if you're having any issues with it. Okay. I am seeing access to care stay right there at 100%. So we're going to head back over to the slides and keep going. Okay. A little bit about AIDPH, who we are and how we got here and why we're here talking about better oral health today. So we're a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. When we say our community, we mean you, folks in the dental public health workforce who are out there advancing oral health. We do this work because we have a vision of a justice-oriented oral health system. We have 4 communities of focus at AIDPH that includes LGBTQIA+ folks, veterans, people with disabilities, and people living in rural communities. And of course, we understand that there is intersectionality on these 4 communities, amongst these 4 communities. For example, approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area, something that we'll talk about more today as we dive into the data. And all of a common experience of historical exclusion and marginalization from healthcare systems. We want to take a minute and thank our funder for this program, which is CareQuest Institute for Oral Health. We have an extensive partnership with them on our research of oral health, and this is just a quick overview of the timeline of kind of where we started and how we got to where we are today. We started way back in 2021 with a survey on veteran oral health, understanding that there was a lack of data and understanding on what veteran oral health looked like. So we partnered with veteran service organizations to conduct community engaged research and really work with veterans themselves. And that research progressed from there, looking at bigger data sets, publicly available data sets, doing deep analyses. Along the course of that work, we were repeatedly being asked, we were looking at things at a national level, which we're going to talk about that in just a minute. But we kept getting asked, what does it look like in my state? What is the state specific information? And so we really took that charge and developed out these state profiles, which we'll also be talking about here today, so that we have a profile in every state in the country to look more in depth and to provide some really usable tools that folks like yourself at the state level doing the work have easy resources with the data to reinforce their work and support what they're doing. So that being said, let's take a look at veteran oral health, starting with a national overview. So this might be familiar to some of you. I know some of you on this call, and I know it's familiar to you, but we've really found that many people, sometimes even including veterans themselves, aren't fully aware of how VA medical and dental benefits actually work. So that's why we like to start at the beginning, setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So here's the key point to take away. Eligibility for medical and dental care through the VA is not set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change, like expanding dental coverage, requires congressional action. So it's not just a policy update or passing, it really requires passing new legislation and securing federal funding to support that legislation. So when we talk about the limitations in access to dental care for veterans through the VA, it all ties back to laws at the federal level. However, I also want to point out that that doesn't mean we can't take action and impact change at the local and state levels. The first step in that is getting educated, like we're doing here today, and then collaboration with our local communities. And we're going to share some success examples later in the presentation as well of what some innovative things that different states are doing. Okay, diving a little bit more into this national overview. Currently, most veterans are not eligible for dental care through the VA. So if we look at this graphic here, this top row of people we see represents all 18 million veterans living in the US today. The lighter colored half shows the veterans who either receive care outside the VA or aren't eligible for VA healthcare. As you move to the left on the chart, that darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. But of those, only a very small fraction, that small blue and red segment, is actually eligible for dental care through the VA. An additional point to this is that among the about 1.8 million veterans who are eligible for dental benefits, only about a third actually use them. So we need some more data to understand that utilization number, but we suspect that barriers to care and lack of awareness play a really big role in that utilization piece. Okay. So I think it is no surprise to many of us working in clinical dental care or dental public health that there is a major role with oral health care and chronic disease. We're going to dive into that a little bit here, specific to veterans. Veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. And what's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non veterans, even if they've seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting dental care, many still face some of the worst oral health outcomes. And a big reason for that is lack of integrated care. Those chronic conditions aren't being addressed in coordination with oral health needs, and it's really impacting the health outcomes that we're seeing. So looking at that a little more specifically, I'm sharing some recent research from AIDPH that we conducted in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth, compared to veterans without diabetes. That's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. So that reinforces what we're seeing across the board, that chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. And when we think of this at a healthcare system level, what we really want to highlight is that it's not just about poor oral health outcomes or reduced quality of life, though those are obviously very serious concerns. It's also the broader the broader health impact and the cost of care. So when dental care is managed as part of an integrated healthcare system, like what we see, what the VA could offer if dental coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's paying for itself. So this is an important context to keep in mind as we look at chronic disease trends in West Virginia and consider what solutions might look like in your state. Okay. So these are some data points collected through research from AIDPH and CareQuest. They come from BURFIS, a national survey of veterans administered in 2021, and from data accessed through the VA. So kind of looking at this piece with rural veterans, we'll go into this a little bit more here. So I'm sharing this out. These are from vetdentaldata.org, which we will pop into the chat. This is our interactive dashboard. It is where the state profile that we're going to dive into lives. This is where we really want to highlight the tools that we offer and where you can go and look at kind of the different pieces of manipulate the tools and look at the data that you need for your state. So there's more interactive insights on rural veterans, cost of care, and state-based indicators. We have an entire tab dedicated to rural veterans. While the data aren't available from MEPS, which is the Medical Expenditure Panel Survey, they're not available on a state level. They can be evaluated by region, so you can get a sort of proxy for state level data with this tool. Okay, looking at another view of this. So when you're on vetdentaldata.org, you can click on the rural tab. It will take you to the interactive dashboard on rural veterans. And across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. So this is all veterans. It's just veterans versus rural veterans on this data dashboard. Okay. Rural veterans also feel more impact from lack of access and utilization to dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with functional dentition, which likely leads to the data points we see around increased costs of care and higher emergency department use. Okay. So looking a little bit more into the research here and where all this information is coming from, in addition to those interactive dashboards that we have available on Vet Dental Data, we also have all of our publications that we have done on veteran oral health. What you're seeing here is really just a snapshot of the research and tools that we've developed to help organizations like the ones that you all work at. And it's a kind of, this information can be tough to find. And that's why we feel really dedicated and driven to have pulled it together and put it in this accessible place, and why we're having these conversations and making sure that folks understand that these resources are available. Okay. So to kick things off, I want to share a little bit about West Virginia and give you some background. So again, if you go to Vet Dental Data, we encourage you to pull up your state profile so you can kind of go along as I walk through those pieces here today. So if you click on publications and go to West Virginia, you can pull up your state profile. If you go to the map and hover over West Virginia on the interactive map, you'll find a detailed profile. Okay. So before we dive into that information, we're going to toggle back to Slido and hear from you all again. So we would love to hear sharing one word, naming what you think your state's biggest challenge is for veteran oral health. I'm going to toggle over and we can see what folks say here. Access, 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 access. Yep. Value. Literacy. Yep, we're going to talk a little bit about that oral health literacy. Confusion on eligibility. Yep, I think there's a lot of opportunity there. Navigation, really the navigation, confusion for eligibility, literacy, those pieces for me all really connect. And access is number one. I don't think we have gone to a single state yet where we've done this exercise and access hasn't been the number one piece there. I see navigation getting some double tapping. This is great. Thank you everyone for participating. Okay. Cost. Okay, great. If you haven't had a chance to enter, we encourage you to continue to do so even as we go back to slides. Okay. So now we're getting into the really good part, why we're here, your state, and talking about what do these oral health profiles look like for West Virginia. So again, I think folks have already pulled them up, and I will just reiterate that this rotor is really as much for us to listen to you and learn from you and hear about West Virginia. You know your data best. You know the context of your communities. And so we really encourage you to share out your reactions, ask questions. Your insights help us improve these profiles and make sure that the tools that we're providing with the data and the analysis that we have done are actually useful in your efforts to support veteran oral health. We've done our best with the data available, and while it's limited, these profiles aim to offer clear, visual, easy to use information that can support conversations and decisions across different audiences. So I hope you chime in with your thoughts as we go along here. Okay. So just giving some context to how these profiles are set up and why we set them up the way that they are. So we open each profile with some quick context, just like we did in this seminar, what's happening in West Virginia and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. And again, the key point that we're always including and making sure that we're sharing with those decision makers is that most veterans are not eligible for dental care through the VA. I feel like I sound like a broken record, but we really repeatedly find that that is surprising to the majority of people we're talking to. So again, if you're going to folks like policymakers, funders, decision makers, it's something that they might not realize, and it's a really great place for you to start the conversation. Okay. And because of the gap at the federal level, it's states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges, which again, if you're working with those legislators and decision makers at the state level, a really powerful place to begin. So we've also included data on where veterans live across West Virginia, especially counties with high concentrations. And we've pulled in whatever we could find on rural veterans. Veterans, again, are more likely to live in rural areas. And as we know, rural communities already face higher barriers to care and worse health outcomes overall, which is why we're pulling in those pieces. So right up front, we hope this gives you useful county level insight to support better informed local decisions. Looking at those top 3 counties might help you decide where to start, where programming should focus, maybe organizations to get in touch with based on those locations. Okay. So here we compare West Virginia to national averages because without that context, the numbers don't mean much, right? So if you're sharing with a policymaker, a veteran, a program leader, they might not know if 6% is high or low, somewhere in between. That's why we've included national averages to help you quickly see where West Virginia stands compared nationally. The other tip that we like to talk about here is that you can also compare across states if that's helpful. I mentioned that we have these profiles for every state in the country, so you can pull the profile and look. I'm also going to share some screenshots of the data dashboard that show you kind of a quick snapshot way to hover over and find comparative data in just a moment. So the thing is that some states, you may know from your work, have similar challenges or demographics. And as someone working in West Virginia, you probably know which comparisons make the most sense. So if there's a state you work closely with, colleagues you have in a certain state, or if there's a state with a success story and you have colleagues there, it might be a great place to ask to see what their model is and if that could be replicated. Okay. Earlier, I mentioned chronic diseases, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections come through strongly in our research, we wanted to make it easy for you to highlight them when you're talking to decision makers. And that's why they're located here. So you'll find data on heart disease, diabetes, insurance status, and indentulism, all compared to those national figures. We also ranked each state across those 4 outcomes, so you'll see where West Virginia falls compared to all 50 states. And just noting here, it says it across the bottom, but number 1 is the worst. So when you have those low numbers, it's not better. And if you're interested on how those rankings were done in the data analysis, those details are also posted on vetdentaldata.org. Okay, so then we go into the grade portion of the profiles, and we see the grades individually given for diabetes, rates of uninsured, and dental visits. The percentage of veterans in West Virginia that visited a dentist in the past year, and those combined then for the overall grade. So, a report card can be tricky to look at, right? If there's some pieces where we're not having the outcome that we want or that best grade, it can be tricky. But again, an alternative point is to look at a part where we might be doing a little bit better, or if we have a state that is similar that has a little bit of a better grade, what got them there, or what got us there to the successful pieces that we can take those lessons learned and apply them to the areas where we need to focus based on the report card we have. Okay. So I talked about kind of highlighting that comparison piece and how to do that with the dashboard. So this is a screenshot of the dashboard. Again, this section just kind of pointing out some usability here. It allows you to quickly gain insights on key indicators. So comparing other states to oral health status of veterans in your state. So this can be helpful for decision makers who want to gain insights into their state, your state, and surrounding states when it comes to improving veteran oral health. So it gives you the opportunity to kind of quickly gather comparable data for easy, fast visual comparison. And also might give you a sense of who to then go and pull those bigger profiles from. Okay, so that was a lot of information, and I'm going to pause and give you all a chance to respond and let us know your thoughts. So if you could take a minute and pop in the chat, we would love to know what is one barrier that isn't in the data, but you know is real for the veterans in your community. We mentioned that the data is limited, and so we know it's not all encompassing. So we would love to hear if there are other pieces that you are seeing in West Virginia that isn't reflected in the data that we've covered here. And Annalise and Shayla, I will let you all call out if there's pieces in the chat.
Yeah, Bobby had mentioned oral health literacy.
Got it, yeah.
And then Brittany also states education.
Yeah. I think some similarities and some connections. And I'm curious if you all know of programs that are working on those literacy pieces, or are there levers that could access and deliver veteran-specific oral health literacy pieces? Okay. We will keep going, but if there are other pieces that occur to you all, please continue to post them in the chat as we go through here. Okay. And if you are doing work that could be a potential solution to some of the things that your fellow stakeholders are posting, please share that out. This is kind of, we're always approaching things in an all teach, all learn method. Okay. So, again, that was a lot of details, and I hope going through them was informative. But what I really hope that you take away from this session is next steps and how you can leverage this as a tool in your work. So we're going to talk a little bit more about how to use these profiles, using the data to illustrate the need, sharing the profile to start conversations, and taking action and elevating success stories. So let's dive into that a little bit more about some ideas. And if, as I go through, you have questions that are pertinent to your work or thoughts about the way that you could leverage this in the work, please chime in the chat or feel free to come off mute. Okay. So veteran advocacy, one of the most powerful things that we can do with this data is advocate. That can look different depending on your role. Maybe you're a provider, a policymaker, a veteran yourself. This profile gives you credible local data to bring to your city council, state legislators, your congressional reps. You could also organize a listening session in your community. You could invite decision makers to hear veterans speak for themselves. And remember that small advocacy actions like calling an elected official, submitting a public comment, they can ripple outward in big ways. So it doesn't always have to be when we say advocacy, it doesn't always have to be legislative advocacy. There are other pieces, sharing this out and sharing the education, sharing this information you have, doing smaller daily steps versus one big hill day. That all is encompassed in advocacy. And those little pieces really add up. Okay, so to that point, educating to empower. So many people working in healthcare or veteran services don't know the stark oral health, how how big that oral health gap is. And that's where education comes in, right? Step one. So you can use this profile to lead a short talk with your organization's staff meeting. You can share out the recording to the session to your colleagues, to other organizations that you think might be interested. Um, you can brief a coalition or a partner organization with this information. We find that when stakeholders are informed, they become allies. And that's really how we build momentum. So this is an opportunity to collaborate across silos. Maybe you're bringing it to someone in housing or mental health or food access, and you find a new way to align your efforts in the work that you're both doing and form those coalitions. Okay, informing strategic decisions. So we really hope that this data is a tool for strategic thinking, whether you're leading a nonprofit, managing a health program, or advising on policy. You can use the profile to help decide where to focus. Again, kind of going back to those pieces, looking at the county specific information, that could be an area of focus. Looking at the grades and kind of programmatically versus geographically where to focus. There's a lot of ways that it can direct our work. So it also helps you make the case for why you are investing resources where you are. And if you're doing evaluation or reporting, it gives a baseline. So here's where we started, and here's where we're trying to shift to, which we all know is very important in public health work and funding. So this is what we're going to talk about a little bit more and talking about how it can bring in resources. So grant makers and funders want to see data and they want to see it grounded in the community. So this profile, we hope, gives you that. You can use it in a problem statement for the grant that you're writing to show the gaps in care. You can also cite it as, again, a foundation for what your solution will address, as a benchmark if you are measuring outcomes and deliverables of a program. Excuse me. Mm. Um, so again, really kind of supportive information that we hope is very easy to access um, as we go through. Okay. So I'd love to pause for a second here and ask which of these four uses for the state profile, advocacy, educating stakeholders, decision making, or grants, do you think is most relevant to your role and or organization? You can come off mute. You can pop it in the chat. We'd love to hear from you.
Tiffany said decision making.
Fantastic. And I will also say conversely, if those don't feel relevant for your work and there's something else you need, we're going to have a separate poll for that in a second, but we're happy to hear those pieces too. So please feel free to share either way. Okay. Again, if something occurs to you, please feel free to post or chime in even as we move along through it. Okay. We're going to pull it up in a poll now. And again, we always want to be leveraging your tools and our research to best serve the work that you're doing. So we want to hear from you about what additional tools would be most helpful to your work. So I'll pull this up here. You all can toggle back to Slido, educational material. So I'm really seeing that aligning with the health literacy pieces that we were seeing before. Research findings. Yeah, and if there are pieces kind of to that data point or barriers you're seeing in your community where you think we need more data, more research, share that in the chat as well. We would love to hear about that piece. Okay. All right. So again, please continue to respond if you have not already done so as we continue to go through here. Okay. So I said at the beginning of our presentation that we were going to share out some success stories um, from other states and some innovative examples. So we're going to look at 3 different states here and talk about some innovative options and why we think that they could be helpful. So Florida passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. So this program is designed to provide dental care to veterans living in Florida. The department will partner with a statewide direct support organization to administer the program, and that organization will distribute grants to nonprofits with a strong record of supporting veterans. These nonprofits will then deliver care to eligible veterans based on income, service history, other qualifying criteria. And I want to point out this is very new legislation. I'm not exactly sure when it passed, but I think the implementation of it just started this April. So we should all be keeping an eye on Florida and seeing how this program is progressing and working. It's a really innovative approach, and it's exciting to see it come together and how different states can find solutions that fit their communities, that fit their political climate. They're all different, but they work for that community. So Oregon's another example. They've developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either. And if not, they're enrolled in a local coordinated care organization to receive free dental care through a network of community clinics participating in the program. And then in Iowa, we're going to talk about Iowa a little bit more in depth here in just a second. But the state uses lottery dollars to fund the Veterans Trust Fund. So this fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. And so speaking of Iowa, we're going to go into that in a little bit more. We have had the privilege of working in Iowa for several years now. We did a very deep dive research project, and so we have these state profiles, which give a fantastic snapshot of veteran oral health in each state. In Iowa, we had the privilege of doing a year-long research analysis in their state, and I think the report we produced was about 70 pages long, many strategic recommendations. And then we were able to go out and talk to the community, work in the community, bring those recommendations to them, and continue the work. So we share that really as kind of a model. If your state is primed and ready to take action at a deeper level, these are some steps you can take to kind of pull the coalition together and start making change happen. So just sharing out a little bit what that process looked like. Again, we started with a report. Then we were able to take that report out and do a series of virtual community forums that culminated with an in-person veteran oral health summit in the state where stakeholders came together, looked at the recommendations that we made in the report, and pulled out the ones that were most viable based on the environment in their state. And from there, we have summaries of all of the sessions that we've done with Iowa stakeholders, and we are about to publish a strategic plan that we conducted in partnership with Iowa stakeholders that really lays a path, a really clear, hopefully very easy to follow path to implementing these strategic recommendations in Iowa for the stakeholders there. This is just a highlight of some of those strategic recommendations. You'll see that Veteran Trust Fund really came up over and over again as an opportunity for expansion and a spot that of focus because it's successful, and further expansion could bring even more health access. Okay, so I'm going to pause again. We always want to hear from y'all. And before we kind of go into discussion, does anyone have any questions I can answer? Okay. Hearing, Sheila, I see you looking. Did someone post something in the chat that we need? Okay. All right. Okay. So we would love to hear from you. Do you have a success story in your work? Are there other organizations that are working on this that we should know about, or you think the stakeholders in your organization, is there work that you're doing that you want other stakeholders in veteran rural health in West Virginia to hear about? We would love to start there and hear about your work and what you need from fellow stakeholders, what you want fellow stakeholders to know about.
Hey Liz, it's Bobby Joe. We just wrapped up our we called it Stars, Stripes, and Smiles learning sessions, as you're aware of. But I think the reoccurring theme, and my team can weigh in because we all kind of everybody participated in those, but that confusion on eligibility, and even from stakeholders all the way down to the veterans themselves, of who was eligible and navigating that system, is really one of those things that I think would be fortuitous if somebody could come up with an easy way to, I don't know, like a whole care navigation team from the VA. And I think we in West Virginia face the technology piece too, because not everybody has access to reliable Wi-Fi and a smartphone and a computer and all of that. And then when you look at the demographics, they're older individuals. Like, we use Jana's dad all the time as an example of someone that, he's not gonna be able to get on the computer and enter his data and find where he can go and what he can do. So I think that's really something that I don't know if anyone is addressing that yet. If they are, we're unaware of it, but we think that's something that definitely needs to be looked at and dove into a little bit deeper.
Or even like they do on the medical side, they have all these community liaisons that help connect the veterans to different services to reduce the travel, but that's not available really for dental, or at least not in my family's experience.
Yeah, that is so relevant, and we've heard similar things in other states as well. And I know I'm assuming we potentially have some veterans on this call. I know we have at least a few different spouses of veterans on this call, and I'm curious, do for anyone who might have that personal insight, do you think there could be a local approach to that? Could we go to the local bases, the local VA hospitals, and work at that level to create that care coordination or that community educator? Or do we think it has to be national? And we might not have the answer. The answer might be we don't know, but I wonder if anyone
I think it's already there.
Yeah,
I mean,
with medical.
kind of like a community health worker, in the broader public health world, that those community liaisons are already there helping the veterans find local resources. They just don't ever have any insight for dental or oral health, or so seems like you could just train them for the oral health, which then I know leads to well, then who in the community is providing services, but there's FQHCs everywhere.
Yeah. Yeah, so it's a matter of pulling together educational materials, pulling together someone to connect with those community care coordinators with the dental piece because they already have the medical piece. Is that what I'm hearing, Brittany?
This is Jana, but yes, that's
Sorry.
only from my experience trying to help my dad and brother find
Yeah,
providers.
yeah. Tiffany, did you have something to share?
I did. I can speak to it from both angles. I'm a dental hygienist, but I'm also a veteran, and I utilize medical services through the VA. I utilize a VA hospital, and I also utilize a CBOC, like a a local clinic here in Morgantown. And I have never, in all the years that I've been receiving care from the VA, been asked about my oral health, and they don't look in my mouth, anything like that. Maybe because my provider knows I'm a hygienist, but still.
Mm,
And I've had conversations with my doctor that that I work in public health and that I would love to serve veterans, and the VA is a very challenging animal, in more ways than one. And I think that maybe the best solution would be to advocate directly to the CBOCs, where you can actually have a conversation with with those doctors, because they're the ones that have the continued care with a lot of veterans, and they can kind of bring it down to that level.
mhm,
And I would be curious to see how that would translate into maybe something that would be effective into coordinating care for the veterans that are seen in the CBOCs, because I just don't think those conversations are happening. Um, but being on this call, it reminds me that I can do a lot more. Every time that I set foot in the CBOC, I can ask questions and find out ways to direct veterans, to care. So
yeah, yeah, I love that. Um, I know it's very complex, but I think, some pieces that I'm hearing kind of from the collective responses here are I can see some pulling together of the resources that exist I think oftentimes in public health, when we're talking, Tiffany, what you said, a hearing of you're not being asked in a medical setting about your mouth. And I feel like often in public health, a solution feels like in those intake forms or those conversations. But then if the providers don't have an answer of, okay, you haven't had a dental appointment in 3 years, but I don't know what to tell you, right? So they might not be asking if they don't have the resources. So maybe it's a matter of pulling together the options. And I heard education a lot, but I think a lot of it was maybe with the veterans or the patients themselves, but maybe there's a medical education component of educating our medical providers, our VAs, our care coordinators about the dental care options that exist within the state. And pulling together those resources for them.
absolutely. And one
Yeah.
other comment that I had, I do not feel that the best solution would be to expand coverage for veterans through the VA system, just because that uh, it would be really difficult for all those veterans who are in the system to utilize oral care services through the VA if that was expanded. I just don't feel like that would work. But on the other point, you gave statistics. I think it was 582,000 veterans in the nation qualify for oral health services. And I don't think that I heard, unless I missed it, the reason why. So just to educate everybody on the call, for a veteran to receive dental services, they have to have a 100% service connected disability. So they're permanently and totally disabled. And that looks different to many people. It's not always a physical disability. A lot of times it's, PTS or traumatic brain injuries, things like that. Or that veteran has to have a dental related disability. Say they had trauma to their mouth, and so then they're able to receive dental care through the VA. But those are the only veterans who are eligible to receive dental care through the VA. As other than somebody who has been recently discharged, I think they have a short time to complete any dental care that they were receiving when they were in active duty. So that is the very, very few veterans who are eligible for VA care.
That's right. Yeah. Yeah. And just a little more context too. We did see the eligibility for dental care increase in the past year due to the PACT Act. And that wasn't because the PACT Act directly increased eligibility for dental care. It increased the number of veterans who were 100% disabled. And so therefore, by connection, were eligible for those dental care benefits. And the 500,000, that's the utilization rate piece. We have about 1.2 million eligible. So it's, again, like you said, kind of complex. And I think for veterans to navigate that piece, it's complex for them. And I think I realized we had open Hill Day where we were talking about veteran oral health and had a great conversation there. That I noticed for myself, for those of us who are connected to the military community, found myself often just kind of throwing around the term disability rating, and realized for folks who are not connected to the military community, that might not be an obvious term to understand. That kind of veterans, as they're getting out of service, go through a process where they might have different injuries pieces where they get a rating on disability, which is a little bit of a unique concept to understand if you're not immersed in that community. So I've been trying to make a point on these calls to explain that a little bit. Thank you, Tiffany.
Liz,
Bobby,
yeah, I
yeah.
do. And it comes back to what Tiffany was saying, I don't know, my husband is 100% disabled, and I always share my why that this work is passionate to me, and the fact that, he has that coverage, but we have to pass 18 different dentists that are within a 20-minute drive, 30-minute drive of us to get to the VA, the clinic in Clarksburg. And if we do get the care in the community and get that approved, one change, and we are hearing this too from our Star Stripes and Smiles listening and learning sessions, is the dentists are really frustrated because they start a treatment plan, but if that one thing changes in that treatment plan, they have to get approval for all of that, and it starts all over. So it's really the system itself is a little flawed, to even for those that are 100% disabled. So there's some things that I think even can be addressed at that level of, and we were hearing that from the dentist, like, they want to see the dentist in the community. They would love to, or the veterans in the communities that they live in, because those are the people they go to church with, that they, go to their ball games with and sit near, things like that. But yet to have to like say, well, I can't go ahead and see you because this is going to turn into a crown instead of a 3-surface amalgam, and having to have to go through that whole process and the delays there with all of that. So we are hearing a lot of that. But even with the 100% disabled, I think, Tiffany's right. There's got to be some, that system needs fixed somehow. And I don't know.
Yeah. And I think that's a really important point. And when we talk about the intersectionality of veterans and rurality, and veterans living disproportionately in those rural areas, they might be eligible, but that doesn't always line up with where the VA clinic is, never mind a VA clinic with a dental clinic in it, because we know those are more rare, right? And so there were also some pieces when we were at Open Hill Day that we are, part of our ask was, obviously we think 100% eligibility for dental care would be fantastic through the VA. That is a very long game ask, and there's a lot of pieces we can do in the interim, part of which is improving the community care network, which particularly affects rural communities. So that was one of our main asks, and I know Annalise and I had the privilege of having some great conversations with the SVAC and HVAC folks about the community care network and those improvements, because it's something that we hear over and over again from folks working in the VA and folks who either are in the community care or want to be, but the administrative burden on that, which you just mentioned, Bobby, is really big, and it makes it more difficult for everyone. And really, we could remove some of those administrative barriers and improve access to care for a lot of folks, relieve work on both folks in the VA and the community care providers, and just make it overall more usable for everyone. So that's definitely part of the conversation as well. Okay, thank you everyone for sharing your thoughts. It was really fantastic. If you continue to have pieces, please feel free to post them in the chat. We have just a couple minutes left, so I'm gonna go through our last few pieces here. And leave you with a call to action. I hope you're feeling activated. Again, I know it can be a bit of a fire hose. I know it's a lot of information to take in. We're also all busy. So I'm leaving you with one concrete, easy step to take after this session to hopefully keep the momentum of that activation I hope that you're feeling. And that's to share your state profile with one new person or organization. If you're willing to post who you want to share it with in the chat, we would love to hear that. Let's keep each other engaged and encouraged and accountable. But share out, take that as your first step. Take this takeaway to share out. Okay, and our next steps. So I mentioned that CEUs are available for today's session. Those are hosted on our Academy. Sheila's going to post that link in the chat. You can go and complete your CEU request form. In the next few days, we will post this recording. Again, if you want to share out this session or you want to go back and reference something, we will also be posting these slides so you have those to reference. We are also gathering stories from veterans, and we would love to hear from veterans in your state. So we're going to post our storytelling form. This helps with our advocacy work that we do around veteran oral health. I said it about 5,000 times. I hope you don't think I'm a broken record, but you can find all of these resources and data and publications on vetdentaldata.org. And with that, we will just leave you that veterans deserve equitable oral health. And thank you again for participating, for your willingness to be here and learn today, and for being activated on this very important topic and population. I hope everyone has a great rest of the day.